Good morning, everyone. Another day, another edition of Ask Boni. It's my pleasure to introduce Saskia Kaltenbrunner to you. Saskia is one of the younger members of our group here at the Department of Innovation and Digitalization in Law at the University of Vienna. She is one of the few without a legal degree, I must say. She has a BA in Liberal Arts and Social Justice from the University of Warwick, and is now studying remotely a master for risk and disaster reduction at the University College London. Her background is very interdisciplinary, I have to say, with a focus on human rights research and media studies. And before studying this and before joining the team in particular, Saskia has worked at the Ludwig Boltzmann Institute for Human Rights and the Forum for Journalism and Media Research in Vienna. Her research interests are media innovation, media ethics, the role of digital evidence in criminal proceedings, data security and risk management. And within the team, she is one of the most important people, I must say, because she's one of those taking care of that we are successful in applying for grants, research grants, and research projects. And Saskia, what is not mentioned in your official CV, but what is the reason for having you with us today is that you spent plenty of your time in Spain. You grew up in Spain, and in particular, you also spent the critical period of COVID-19 in Spain. So it's my pleasure to have someone with such an international background here, UK, Spain, and Austria, to give us an overview about how the situation was in Spain and how it is there at the moment. Perhaps you could briefly start by telling us how the very beginning of all this looks like with a year of distance now to you, and how you what the main issues and the main feelings then were earlier in 2020.
Yes, certainly. Thank you. Thank you so much for having me. Thank you for the introduction. As you said, I spent the first lockdown in Spain since last March, and then also significant periods of time afterwards. So I've been able to see how it's developed firsthand, which has been a really interesting experience, and I'm looking forward to discussing that. In particular, of course, it's almost been a year now. Looking back, it's almost difficult to remember that initial confusion and what the concerns at the start were, because they have changed so much. No one at the start was talking about these vaccine questions that are emerging now. But essentially, I remember from last March that Spain was one of the first European countries to announce a state of emergency and to go into complete lockdown. And it was also, throughout the pandemic, been probably one of the worst hit countries in terms of infection rates and numbers of deaths. So I think going back to last March, really the main feeling that I remember was this sense of uncertainty. The only country that had called out a lockdown, I believe at the time, was Italy when Spain went into lockdown, and there was almost some sense of whether this is premature. Looking back, it was probably too little, too late. From there on, Spain went into one of the strictest lockdowns as well for months. So I think really compared to Austria, for example, the measures were really harsh. The number of fines were really harsh. And I can say from personal experience, I really didn't leave the house in 3 months. And I think a lot of young people, in particular children and teenagers, were in the same situation as well. And from there on, there was a slightly more relaxed summer as restrictions were lifted. There was some attempt to save the tourism industry, for things to go back to normal. But obviously right now, looking at the situation, Spain is just starting to come out of this third wave of COVID, as many European countries are. So it certainly wasn't the end of everything when things seemed to go back to normal in July, August. And they have continued to get worse again, probably since September, October.
What is quite similar to Austria, I would assume, is that there is this discrepancy between measures taken by the central government and measures taken by the regions. Would you comment on this?
Yes, very much so. I think in particular, that's been a huge difference between how the pandemic has been managed now compared to how it's been managed a year ago. So in the first wave, there was a really a centralized approach. There was a national lockdown. It was the same situation in my region and in the south and in Madrid. But now, since September, October, measures have been very different from one region to another, from one autonomous community, autonomous region to another. In general, the autonomous regions in Spain have quite a lot of independent decision making from the central government anyway. So it's sort of gone back to that system rather than what was done in the first lockdown. In general, these autonomous regions were closed off mostly. So there were restrictions on travel from one region to another. But then within the region, there were some where restrictions were extremely relaxed, such as in Madrid, for example, even though infection rates in Madrid have been almost the worst throughout compared to other regions. There were certain cities that went into lockdown very early. Barcelona was in lockdown for a long time, but then other regions only imposed curfews. Measures have often changed every 15 days, once a month. So they've sort of constantly been revised, and they've been revised on a very localized or regional level, which has led to some more uncertainty, I would say, about which restrictions are in place at which moment everywhere, which travel is actually allowed, what constitutes essential trips, at what time curfews are imposed, and which establishments are allowed to remain open and which ones aren't. There's been a lot of cases where restaurants would have been allowed to reopen for a month and then close again, but in a almost neighboring village, they would have been allowed to remain open. So quite a few regional differences have emerged, and I do believe this has caused uncertainty as well about what the current restrictions are.
And was this challenged by the population? I mean, is there any political discussion about whether this is a useful approach, that, I don't know, region A does something very different from region B, and the outcome of this might be then weeks later quite different? Or is this just accepted as something which is traditional and well established?
I would say initially, when this was introduced, the response was, at least from my perception, actually quite positive. That this was seen as some sort of attempt to, which it probably originally was, an attempt to not reimpose a national lockdown, and for everyone whose sort of livelihood depends on their establishment remaining open, even if it's just from 9 a.m. to 6 p.m. rather than from 9 a.m. to midnight. This was probably seen as a positive development, as the right approach. I think since then, because measures have changed so much, there has been quite some opposition to it, both in terms of the population and political opposition. I mean, in particular, there have been political parties that have questioned the validity of the state of emergency in general anyway, and there have been quite a few strong anti-lockdown movements. So of course there have been groups that have questions whether we should have any restrictions at all. But there has also been some criticism of this lack of clarity in messaging and is in what is going to happen within the next week. What is allowed for any citizen, and this constant uncertainty as well about whether educational establishments were allowed to remain open, because pretty much schools and universities have remained open throughout, which has led to quite a, well, it's difficult to say how much of the infection rates go back to schools and universities, but there have definitely been some debates about whether it makes sense to close sports facilities, but for schools to remain open, and similar questions.
And what about tourism in particular? So do you have the impression that tourism was an important factor in this, in the decision making on whether or not something should be open earlier than in other regions? Or, and if so, was this challenged, or is this challenged in any way?
I believe that was one of the main concerns already coming out of the second lockdown, that there had to be, because of course by the time, I think the first lockdown, by the time that Spain was coming out of the first state of emergency, it was sort of coming up to June, July. So I think really one of the main concerns was to lay out a plan to come out of lockdown early on, so that there would actually be some sort of tourism, international tourism over summer, which there was, and this had an impact as well, I would argue, on infection rates after the summer. As they started to increase again gradually, it was, the situation deteriorated much more quickly in the regions that largely depend on tourism. So for instance, where I'm from, which is a Mediterranean region where a large part of the economy depends on tourism, not just internationally, but also on tourists traveling from Madrid and then returning back home after a weekend. This was criticized a lot at the time because case rates went up really, really quickly. And you could very directly see the impact of tourism. At the same time, of course, everyone whose livelihood depended on tourism was still pushing for restrictions to remain relaxed. And one of the big factors that maybe played in Spain's favor was maybe the climate in that situation, because it was possible for a lot of establishments to remain open outdoors for a long time, and to try and retain some sort of tourism and hospitality sector throughout September, October, even as more restrictions were introduced again, because it was possible to sit outdoors, to exercise outdoors, which might not have been possible in other places, but in Spain was still possible to do in December, and probably managed to save some part of that sector. But it has definitely been an important consideration to try and reduce the impact on the tourism industry.
So in my view, a lot of what you're telling me reminds me of Austria a year later in a way, right? So this tourism debate, and also the debate about whether or not it would be appropriate to have different regional approaches, and perhaps even the debate on whether or not it would be appropriate to keep schools and universities open. So just to repeat this, schools and universities remained open for all the time?
Except during the first lockdown. Yeah. So from the first lockdown went into summer holidays, but since the end of summer holidays, schools and universities have pretty much remained open. There have been some exceptions, as certain cities have gone into lockdown for a few weeks. But in general, on a national level, schools and universities have mostly remained open. And then, of course, there has been the way this has been dealt with is whenever there was a few cases in a school, either the school would be closed for a few weeks, or certain groups, certain bubbles of students would be sent home, would be tested, as testing has started to become more prominent as well in the last few months. But in general, there has been an attempt to keep all schools and universities reopened. And I think there has also, it might be different at schools, but my impression from universities is that even from the universities themselves, there was not a big push to move things online, at least on a level of professors and people teaching. My impression was that there was maybe not that much support for online teaching in the first lockdown, that it was a bit messy, didn't function very well. So then there was a lot of reluctance to go back to online teaching now.
So it was not so much a political decision that the education of the children is specifically important and that it's perhaps more important than other areas of the economy, but it was more a mixture of not really managing it properly and not really caring too much about it. But
maybe I would say it was a mixture of all those factors. It was maybe also still in a way trauma from the first lockdown, where restrictions were so harsh that I think the impact on children were particularly severe. I mean, of course, this would probably be one of the big challenges just coming up for most places, of the impact on mental health and on physical health of everyone after a year of lockdown. But I wouldn't be surprised if the impacts in Spain were particularly serious, because, as I said, children didn't leave the house in months during the first lockdown at all. There was no going for a walk. There was no leaving the house to exercise. The only reasons to leave the house were really for essential shopping or to take care of vulnerable people. And essential shopping even that was restricted to having to be by one member of the family, which I know was a regulation in many other places, but it was really strictly enforced in Spain. So there was the only reason to sort of leave the house with a child would have been if you were a single parent and had to take your child with you to the supermarket, and that was the only chance to leave the house, which wasn't most people's case. So I think there might still be some element of not wanting to go back to that, and having seen how serious the impact on children was in the first lockdown. And then I do believe it also played a role that that online teaching was not the most successful everywhere, maybe, and so there has not been a strong push to try and go back to that. But of course, it's a political discussion as well, where the right to education is essential, and there has to be some attempt to try and get this year's generation of students to do their final exams, to progress to university. There has to be some sort of attempt of continuity in what is happening in the education system. So it is a debate on a political level as well.
And this very harsh first lockdown is also challenged from a legal perspective. So are there any cases you are aware of, or any lawsuits, anything that enters the political arena in a way from a legal point of view?
I know there was quite a few challenges of fines imposed during the first lockdown, because the number of fines was extremely high. I think I remember seeing it was 3 times the amount of fines that were imposed in Italy, which already didn't have the most relaxed restrictions. And I know that sort of on a smaller scale, quite a few of those fines have been challenged, especially when it comes to, and I don't think there was even certainty about how to handle this from the authorities' point of view at the start, when it came to imposing fines for people moving too far away from their residence and being asked to return home. So there was a debate about whether people should only be fined if they were asked to return and refused, or whether being too far from your official residence was already a justification for a fine in and of itself. And I know that fines were imposed for that. And there doesn't, as far as I'm aware, there's not there's not been a clear decision yet on whether it was justified to impose those fines without a warning in the moment or not. I know there's also the measures imposed in general and the state of emergency itself. Both times that a state of emergency has been called out has been challenged by a political party at the Constitutional Court, but that's not there's not really. I mean, the challenge was sort of rejected regarding the first state of emergency, but it took months the Constitutional Court took months to come out with a statement on that, and I believe the review of the second state of emergency is still in progress as far as I'm aware. So.
And when we come to today, what about how is the vaccination campaign running in Spain at the moment? And is that challenged from a legal or a political perspective?
It is, as in a few places in Europe, of course vaccinations have started, and the progress has been very slow to start with, and is starting to pick up pace now. I don't know if it's around 3 or 4 million people that have received their vaccinations now. They're one of maybe the problems with the vaccination campaign. Maybe in hindsight it would result to be a good thing, but one of the things that has been debated has been that there is a regional approach to the vaccination programs again. So
just like in Austria again, right? So
exactly.
Yeah.
And there is no national approach to the rollout. The vaccines arrive and the vaccines are distributed to the autonomous regions, and then at the start, I think it happened a bit like in Austria as well, that at the start no one quite knew what happened to them. Then they're distributed, and then when do people get vaccinated? Who actually gets the vaccine? This is starting to work in a smoother way now, but it definitely took some time and a lot of debates about who should receive the vaccine in what order. A lot of difficult decisions were, of course, made. The program has been updated many times, where at the start, I believe it didn't include certain groups of frontline workers, of key workers, such as police forces and teachers, and I think firefighters are included now, and all of this including younger groups from certain workforces, only happened after it was announced that the AstraZeneca vaccine would only be used for under 55-year-olds. So
55 or 65?
In Spain, as far as I'm aware, it is still 55-year-olds.
Oh, that's interesting.
Yeah. As far as I'm aware, that was definitely the other argument at the start, and I think this hasn't changed, which now means that it will be used for university staff, school teachers, and quite a few other key workers, but then not other groups of key workers, for instance. So I know one of the debates was about why are supermarket employees not included in this group. So this has, of course, been discussed, as in many other places, and also from personal experience, I would say it is very rare at the moment to have even know when your turn is to be vaccinated. There is maybe 3 or 4 people I know overall that have received their vaccine, maybe a few more, but in general it is only hospital staff, health personnel, and people in care homes and carers at care homes that have received their vaccine so far.
And is there a technology issue also in the distribution of the vaccine? So that I mean, I would assume that, like in many other countries, the administration of where the vaccines go to and who is getting them and how all this is documented needs digital technologies. And in some of the countries I'm aware of, this did not really work out very, very well. How is it in Spain? Would you agree that that might also be an issue?
I have to think about that, but I think the main points that have been criticized are actually more the strategy itself rather than the technology that is being used to implement it. So that's quite interesting, because it's not from my point of view something that has been discussed that much. Maybe because it has just worked quite smoothly. I'm not sure about this, but I know that the debate has revolved a lot more around what the idea behind it is and how it should work in practice, and who can store the vaccines, and where vaccinations can take place in the first place, rather than how technologies will be used as a part of this program. Which is quite an interesting point.
Which is interesting because, for example, in Germany, there is a whole debate on whether data protection is a hindering factor in getting people vaccinated or not, right? And we have similar debates here in Austria, and in how far the ELGA, which is the Austrian system of electronic health documentation, needs to be changed in the way to better support vaccination strategies and documentation of vaccinations and so on, but not in Spain yet.
Well, documentation of vaccines have obviously been a big debate as well, and I think Spain was actually one of the first countries, at least that I remember reading about, considering this vaccine passport idea. Again, probably linked to trying to support the tourism industry and planning for tourism in the summer. But I think I even remember reading about Spain considering a vaccine passport in German and Austrian media at a time when this wasn't discussed that much in Germany or Austria yet. So this idea of tracking who has received a vaccine and of passing on that information, to what extent employers should know whether their employees will be vaccinated. Countries have a right to ask when crossing the border whether someone has received their vaccine. So this has definitely been a debate.
And is there a debate on the privacy implications of this as well, or is privacy not that much of a priority here?
I'd say that is a key point with the vaccine passport. So of course, because there's been quite a strong first anti-lockdown and now anti-vaccination movement as well, one of the key arguments is, of course, that does whether this should be private information or not, as part of your health data, of course. So yeah, and I think these are all, it's quite interesting because in Spain, at least in my perception, they are all relatively new debates. So because this anti-vaccination question and movement has come up before, of course, but I believe it has less tradition than maybe in Austria. But it's gaining a lot of traction now. So I'm only used to seeing these debates about whether vaccines can be mandatory, whether you can request vaccination of children. I'm more used to seeing that in Austria rather than in Spain. But now all these debates are emerging in Spain, of course, where all vaccines are voluntary, as far as I'm aware, and this has not really been a question up for debate. But of course, there were mentions with the COVID vaccine coming up that it would theoretically be possible to make it a mandatory vaccine, or at least to request the sort of form of documentation, and then very much restrict the possibilities of people who haven't had the vaccine. So I do think privacy has come up as part of this debate as well. And do you have
a theory why this is coming now in Spain and later than in Austria or in Germany? Is it because the problems are more evident now than they were before, or is it because of the international debate, or is it because the debate is hijacked by other political movements or parties?
I think it's mostly come from a political movement. So it's mostly come from a political, I would say to a large extent, far right movement, a movement led by far right groups that have become quite strong in the last few years anyway, and that have been a strong voice of criticism to the government now. And over the last year, this has really changed from being an anti-lockdown movement to organizing anti-lockdown protests. And now it's sort of more focused on the vaccination campaign. But I definitely think that from this political movement, the anti-vaccination side of it has started developing an independent life of its own. And now it's more something that is spread through social media, and of course something that comes from the international debate as well, and where international sources are used a lot. And it almost feels like it's jumped onto the train of anti-vaccination debates now that they are prominent in many places. And I'm sure there were some small anti-vaccination groups before, but I just don't think it was as prominent a debate as it was in Austria already before this, for instance.
And what about the upcoming season of tourism? Is this, I mean, are people prepared to another season without tourists? And does that play a role in the vaccination and in the digitalization debate?
I think this is, if there is another season without tourism, this would really put large parts of Spain in a very precarious situation, more than it already is. And this has definitely been something that the vaccination campaign was sort of seen as the solution that would to end all problems. So maybe from the start there was this overly optimistic approach to the vaccination campaign, and this idea that if all vulnerable groups were vaccinated by the summer, or even more than that, if all adults or a large proportion had received their vaccine by the summer, that would save the tourism season. And it is simply looking more and more unlikely that that will happen in the first place. There is no, I don't want to say no chance, but it's not looking likely that all adults will be vaccinated before autumn or even the end of the year, if the current campaign continues at the speed at which it is currently progressing. And I think this has sort of left a gap of what do we do now to try and save the summer season. I don't know if there has really been that much willingness yet to admit that the vaccinations probably will not be enough, probably will not do it. And maybe this is because there is no other solution yet. Maybe the big hope at the moment is the vaccination passport, so that some form of international travel will be possible, or at least some form of internal travel, internal holidays. But I mean, the attempts to save international travel have been so strong throughout. You can tell there's from one, on the one hand, of course, there are the groups that hope that the tourism industry will survive. On the other hand, I think there's maybe even some form of resentment already towards the tourists that traveled over summer and that caused these high rates of infection again. So that is one group as well that has expressed this type of resentment. I mean, there was also some absurdities, I would say, happening during the last tourism season, or let's say in September, October, where as regions were starting to be locked down again, but international travel wasn't really forbidden yet. There was some time where the debate started that currently German tourists could fly to Mallorca and have a holiday there, but people from Madrid wouldn't have been able to. So I think there's some resentment and concern about how the tourism season was handled last year and the impact it had. At the same time, if there is no form of travel at all, there is probably not enough financial support from the central government simply available either to save the tourism industry through this year, and it would cause some really serious consequences, more than it already has, for the next long period of time.
Again, sounds very much like Austria in a way. Yeah. Is a tracing app used or a tracking app used? Does that play any role?
There was a tracking app. I believe that there still is a tracking app, but I would not say it's been very successful. It was introduced quite early, I believe. I can't remember when exactly, but definitely at the time when all these debates were happening everywhere, and again, this at the time caused debates about privacy and security of data, of course, as well. But there was this relatively fast attempt to introduce a completely voluntary, of course, tracking app where people could notify their contacts anonymously if they had been infected or put in quarantine. But I don't think it is really clear what the problem with it was, but it didn't work very well from the start. I personally remember I had it for months and never received a single notification through it, which seems unlikely. There was quite some willingness, I believe, from people to download it and try and work with it from the start. But now that's really gone down. So I believe I remember reading that in around autumn, only about 10 to 20% of people actually had the app on their phone. So at this point, it really can't help much at that point, can it? And it did also feel like surveillance and sort of control of cases and notifying people happened much more through less voluntary methods rather than through the tracking app. So at the same time as the app was not working and people were maybe willing to voluntarily give their health data, but it was not being useful. At the same time, there was all these other debates going on about drones and helicopters being used as a form of surveillance for movement of people. So there was sort of this voluntary and involuntary giving up of data and linked privacy debates at the time. And it definitely seems like the app wasn't a successful part of the program.
It's really striking how much the situation reminds me of the Austrian situation, right? So I think, yeah. Saskia, that was very, very interesting. Thank you. I don't want to take too much of your time, but don't let me finish without asking you whether there's anything that you would like to share with us, something that is specifically important to you.
I believe most things have been said. I do find it as well, and I found it throughout, interesting how similarly sometimes the situation in Austria and in Spain have developed, but then having some key differences as well, so sort of different aspects that the respective governments place their hopes in. So aside from vaccination, which seems to be similar, I know that testing is so prominent currently in Austria, whereas it's not really that big in Spain. And I don't know, and I don't know, and I don't know if this is generally known, whether that is a problem with availability of tests or with an lab analysis capacity, or whether this has simply been betting and putting your hopes on other elements instead. So there's been maybe more of a focus on wearing masks in order to reopen spaces in Spain, which is still mandatory everywhere. Anyway, so even just going for a countryside walk, masks are mandatory in all public spaces. So I think it is interesting to see how, from the start, probably there was the hopes were placed in different elements to get us out of this crisis, but somehow the situation has still developed quite similarly, and we're having the same vaccination and lockdown debates now, to a certain extent.
And do you think that this is random, so that the government randomly decides whether it's better to take, I don't know, the testing approach instead of the wear masks approach, or is this because of?
I really don't know. There is definitely a time where it felt very random. I mean, I think we all remember at the start when no one quite knew how to approach masks, for example. So it went from don't buy masks, they are needed for health personnel, to everyone should wear a mask, and then suddenly they were mandatory in certain spaces, and then the debates about which masks are useful. To a certain extent, I suppose it was availability. Maybe in Spain they became mandatory earlier on and have just remained that way. It's just remained that way throughout now. I don't know if the limited testing that is taking place in Spain is due to availability as well, if it's as simple as that. That in Austria there are more quick and cheaper tests available than in Spain. Because at the moment in Spain, as far as I know, the only possibility to get tests still, unless it's of course after you show symptoms, or certainly a case of COVID, if it's just for private reasons or to go to school, they are still quite expensive. They take a day or two to process. There are some quick tests available, but it's really very, very limited. I've even heard the argument that there is some thought behind limiting testing on purpose, because if testing was increased, that would increase social gatherings. People would overly rely on it. So that, for example, around Christmas, many more families would have come together at Christmas if everyone got tested before. And then, of course, there's the risk of false negatives, and that would have increased cases further. So I don't know if that was part of the logic. It is definitely an argument that I've heard and that I would personally consider a possibility. But I don't know how much of it is random. It's interesting.
How is the translation between the scientific evidence and the political system organized in Spain? Is there a group of scientists advising the government, and is it the federal government, or is it on regional basis? And is this challenged in any way, or is it just done in a specific with a specific approach without challenging or requesting any more evidence on this?
There is the scientific advisory group to the government, which was really prominent, especially during the first lockdown. I mean, I think in a sense, of course, there were criticisms of the way that emergency group handled it as well. And there were criticisms of their main representative, but in general, I think it was seen in quite a positive light, this type of messaging that happened throughout. It was actually quite clear messaging compared to other countries, I would say, where there was these very sort of concise, regular briefs to the population and to the government, and there seemed to be a good translation from scientific evidence to media communication, at least to some extent, or I would say that was the perception during the first lockdown. And since then, it has turned a bit more into this feeling that some decisions are random because they are, and that some decisions are not based on scientific evidence, but rather a bit arbitrary as well, which is probably due to the regional differences and resentments because of this again. So, for instance, seeing that Madrid has barely been in lockdown, even though they had some of the highest infection rates in the country, has caused a lot of people to question some of the measures, I think.
Interesting. So again, quite similar to Austria probably in this point then. Yeah.
I would say so.
Saskia, thank you so much for your time. Really, I appreciated this a lot. Thank you for your time and for the insight that you shared with us. Thank you to our audience. It was a pleasure having you with us. Please stay connected with us, stay interested, and in particular, stay healthy or become healthy as quickly as possible. Thank you for being with us. Bye-bye. We are offline.